Greetings. My name is Dean Mumbleu, and I'm the Republican candidate for the House of Representatives for District 50A. First, I'd like to take a moment to thank the Bloomington League of Women Voters for this opportunity to share my reasons for running for political office. A brief background of myself: my wife Margie and I live in Richfield, just off of Lyndale and 66th. We have resided there since 2008. We have 5 grown children and 1 grandchild. My first career, I was a senior patrol officer for the Sherburne County Sheriff's Department from the mid-1970s to the late 1980s. I've also owned several other businesses throughout my career, and for the last 8 years, I've been the president, CEO, and one of the shareholders of Vision Bank. I am also the holder of 2 U.S. patents. The 3 topics tonight are immigration, healthcare, and employment. The immigration system is broken and has reached the point of total chaos at our southern border. Even though I feel the plight of these individuals, the United States is a nation of laws, and all those that have entered illegally should be returned immediately. With the national debt increasing to unbelievable amounts, how can we justify allowing these illegal immigrants to stay? It is estimated that one of these individuals, if allowed to stay, would cost the U.S. taxpayers $31,000 in government benefits per year and an additional $12,300 in educational costs. Simply put, we cannot afford this additional cost. On health care, it is my opinion that Obamacare and MNsure should be repealed. Under the current leadership, Minnesota spent $40 million setting up MNsure and another $12 million fixing mistakes made on the website. This was a total waste of taxpayers' money. Another reason for the repeal of Obamacare is the negative effect that the new rules have on Medicaid. The new rules made mandatory changes to the program, resulting in the enrollment of an estimated 18 million individuals, according to the Congressional Budget Office. Current Medicaid cost projections are staggering. Over the next 10 years, the federal government is projected to spend more than $4 trillion on Medicaid. The Medicaid program is broken, and it must be restored to its original mission. On employment, we need to change the negative business climate in Minnesota to a more positive one. While other states are teaming up with the business community to create new businesses and employment opportunities, Minnesota's mindset has been to punish, regulate, and tax. A good example of this is the business-to-business tax and the recently repealed warehouse tax. Unless we change, Minnesotans will have to face the fact that more good businesses will either leave or choose corporate inversion and locate their corporate headquarters in other states or even countries. An example of this is Medtronics. We need to create good jobs, good paying jobs, not minimum wage jobs. In closing, I would like to thank you for taking the time to listen to the reasons why I'm running for the Minnesota House, and hope that after hearing what my positions are, that you will support me in the upcoming election. Thank you for your consideration. God bless.
Hi, I'm Representative Linda Slocum, and I am running for re-election to District 50A in the House of Minnesota Legislature. District 50A includes western, central, and a sliver of eastern Richfield, and east and central Bloomington. The committees I serve on in the House are Crime and Public Safety, Commerce, Taxes, and I am Vice Chair of K-12 Education Finance. I am a recently retired 8th grade teacher. I taught English and social studies for 25 years. Richfield has been my home for about 20 years. In my community, I served on the Community Services and Human Services Commissions. I have a bachelor's degree in psychology and have done postgraduate work at Augsburg College. Currently, I'm a member of the Chicano Latino Affairs Council and the Midwest Interstate Passenger Rail Commission. I also have a really cute dog named Orpheus. Immigration. The issue of immigration needs to be addressed at a national level. The Minnesota legislature did pass legislation to help our immigrant populations, but we affect very little as far as immigration goes. The Minnesota Prosperity Act, otherwise known as the DREAM Act, expands access for undocumented students to resident tuition rates, state-based financial assistance, and private scholarships at Minnesota's public colleges and universities. Students have to meet these guidelines: attend a Minnesota high school for at least 3 years, or graduate from a Minnesota high school, or get a GED in Minnesota. Apply for legalized immigration status as soon as they are eligible. If they meet those guidelines, they can access. We also revamped the system for English language learners with the aim of better English proficiency. This includes training for teachers on effective instruction and an accountability system to ensure achievement. We specified a definition for students with limited or interrupted formal education to recognize and help students with barriers to their educations. As Vice Chair of the Education Finance Committee, I was honored to participate in crafting and passing this legislation. In healthcare, with the Affordable Care Act, the MNsure making coverage easier to obtain for Minnesotans, Minnesotans have more coverage than they ever had before. The state's uninsured population has dropped by over 40% to 4.9% uninsured. Because Minnesota has a state-based exchange, and because our Commerce Department regulates health insurance rates, most Minnesotans have access to health coverage with lower premiums than anywhere else in the country. Most people like what Obamacare does, even if they don't like Obamacare. People like provisions such as banning insurance companies from denying coverage for pre-existing conditions and closing the Medicare prescription drug donut hole. People like allowing their kids to stay on their insurance plan until they're 26 years old. Businesses like the tax credits they get if they offer their employees insurance coverage. As far as employment goes, I believe strategic investments in economic development is an important part of building our economy and a strong middle class, partnered with high-quality schools, affordable higher education, quality job training, and living wage jobs. Recent indicators demonstrate that Minnesota's economy is on the right track. Our unemployment rate is among the lowest in the nation. We create jobs at a faster rate than other states, and our economy is growing well above the national average. The tax bill included numerous job creation provisions, such as the angel investor tax credit. The tax bill also paves the way for public-private investments in the Mayo Destination Medical Clinic, the Mall of America, and 3M. In summary, the last 2 years have brought many positive changes for Minnesota. Our state is clearly in a better place than it was 2 years ago. An issue that concerns me still, though, is that while our unemployment rate overall is shrinking, unemployment for our communities of color is not diminishing as much. I would like to work to resolve this so all Minnesotans have the training and education needed for a good living wage job. The other issue I hope to work on is transportation. We are woefully short of funds to repair and maintain our roads and bridges. We need to expand our mass transit system also. We must find creative and fair ways to fund this. It's a great honor to serve the wonderful people of Richfield and Bloomington. I hope to continue to work for our communities. I would be honored to have your vote on November 4th. Thank you.